Good afternoon. Today, we reported an additional 259 Tulsa County residents who have tested positive for COVID-19, which, as you might imagine, is a new record for daily positive case counts. Our cumulative total of cases in Tulsa County is 2,742 people who have gotten COVID-19. The good news is that 1,619 people have recovered, but we currently have over 1,000 confirmed active cases of COVID-19 in Tulsa County, and unfortunately, 66 residents have died. Please keep those families in your prayers. I said all along, it's important to follow the data and make data-driven decisions regarding the response to COVID-19. As you might have heard yesterday from our colleagues in Oklahoma City, numbers for the month of June are growing in the state. We are seeing those same steep upward trends here in Tulsa County. With the uptick in positive cases, here's some of the trends that we're starting to identify. For the week of June 14th to June 20th, new cases increased by 92%. The 18 to 35 age group represented over 40% of all new cases, had a nearly 90% increase in new cases last week. The age group 36 to 49 is the second largest group to have new cases, with 28% of our new cases from that age group. Hospitalizations for the age group 18 to 35 saw a 133% increase over the previous week, and that group represents 25% of all COVID-19 hospitalizations in Tulsa County. In the early stages of this pandemic, everyone took our advice very seriously. We flattened the curve, we avoided surges in our healthcare systems, but after months of the same messaging, the data is starting to show us that individuals are becoming lax regarding public health recommendations to protect yourself. We've now had 2 cycles where our actual reported cases are bigger than our modeled numbers. We knew we'd see an increase in cases as our local economy reopened, but this has been higher than projected, and it's concerning if we continue this upward trend of new cases. People between the ages of 18 and 50 account for nearly 70% of all of our new cases. These individuals are more likely than ever before to be carrying this virus throughout our community, as they are the most mobile demographic. If you are in this demographic, you may think you are invincible. Right now, more than half of all hospitalizations are for people under the age of 50. What we are seeing in the case spike could be a precursor, because in the last week, though we have not yet seen an increase in deaths, we have seen an increase in hospitalizations. While the risk of severe complications is lower for younger people, they can spread to those more vulnerable, like their parents or immunocompromised friends. While hospitalization numbers are at an all-time high for COVID-19, we are not close to overwhelming our healthcare system, but we want to stay that way. We are in regular communication with our Tulsa hospitals and paying close attention to what the data is showing us each day. The Tulsa County Health Department continues to conduct epidemiological investigations, including contact tracing for all COVID-19 cases in Tulsa County. The team of nearly 60 public health professionals assist with case notification, contact tracing, and risk assessments. A representative from the Tulsa Health Department will call individuals and facilities that have been exposed to a confirmed case to assess the risk and make recommendations regarding isolation and quarantine. We need people to answer that call. We understand everyone has concerns what this might look like during their 14-day quarantine. They are worried how that might impact their job and financially supporting themselves or their family. We want to correct misinformation about the importance of following the advice of public health professionals to slow the spread in our community. We are here to answer your questions, provide documentation for your employer, and assure you that you are doing the right thing to protect yourself and protect others. As positive cases increase, we are continually assessing contact tracing needs and have the ability to scale up by reassigning staff in our department and utilize the Oklahoma Medical Reserve Corps to meet the need in Tulsa County. If you are interested in volunteering to support our public health response efforts, please visit their website at okmrc.org. During our contact tracing of positive cases, there are locations routinely coming up as places where clusters of exposures have taken place. Our epidemiologists have identified transmissions that have occurred at faith-based activities, funerals, small house gatherings, and other small events. Our public health colleagues in Oklahoma City have dubbed these and other locations as the Serious 7. locations where disease transmission is likely to occur because they involve larger numbers of people coming into close contact with each other. These serious 7 are weddings, funerals, faith-based activities, bars, gyms, house gatherings, and other small events. This doesn't mean every one of these locations aren't taking the right public health measures. It's just locations we've identified as places where cases are coming from based on our investigations. We are not seeing a large amount of positive cases from grocery stores, likely due to social distancing measures in place. It's still important to wear a mask when entering a store or any other retail environment. There were a number of events and large gatherings in our community last weekend. It's still too soon to know the outcomes from these events. Our guidance to those that were in attendance is to be tested at one of the 11 testing sites in Tulsa County at least 5 to 7 days following the event. We have information on testing sites in Tulsa County on our website, and I encourage everyone seeking tests to visit our website for a list of those resources. You should also monitor yourself for symptoms for 14 days and contact your healthcare provider if symptoms develop. Wear a mask to protect others in case you've been infected and are not showing symptoms to avoid transmitting to others. We want to keep Tulsa County residents and visitors safe if they choose to attend a large gathering. But please, let's be clear about this. Anyone planning to attend a large-scale gathering will face an increased risk of becoming infected with COVID-19. So again, and we will continue to message this as long as we need to. If you are part of a vulnerable population group, which includes those 65 and older or are immunocompromised, please stay home. Seek out ways to participate virtually. If you are sick or have been recently exposed to someone with COVID-19, stay home. Also, seek out ways to participate virtually. If you attend, wear a cloth face mask and wear it correctly. The whole point of wearing it is to protect those around you in case you are infected and you don't know it. Your mask should cover your nose and mouth, fit snugly against the sides of your face, and allow you to breathe easily. Avoid touching your face. Wash your hands with soap and water often. If those aren't accessible, use hand sanitizer containing at least 60% alcohol. Be kind to those taking your temperature if that is offered at your gathering, or check your temperature yourself beforehand. If you have a fever of 100.4 degrees or above, seek out options to participate virtually. You know, I'm not sure when masks became a political issue, but masks are very much a public health issue. Wearing a mask is a selfless and kind act, and it shows that we care about others. We care about more people than just ourselves. Our world, frankly, can use some small acts of kindness right now. Until there's a vaccine or 60 to 70% herd immunity, this is our new normal. Masks are our new normal. Although the Tulsa Health Department is not mandating or enforcing everyone to wear a mask, we continue to stress the positive impact that wearing a mask makes for you and those around you. The virus is still here and is not gone just because we've reopened our communities. All these public health recommendations aren't to stop the virus from spreading, it's to lessen the spread among people. This isn't meant to create fear and panic. We're just telling the truth here. We want to highlight the importance of personal responsibility to not only keep ourselves healthy from illness and disease, but also our family and our neighbors. With this increase of numbers also comes a COVID-19 infodemic wave that can compromise our ability to maintain a balanced, evidence-based perspective about our current situation. We want to make sure Tulsa County residents consume information that comes from trusted, reliable, and data-driven sources. As a public health agency, our job is to provide the guidance and recommendations to keep our community safe. Tulsa County has done a tremendous job over the past several months to slow the spread and allow our hospitals time to prepare. The next 6 weeks are going to be our most critical as we try and lessen the spread in an effort to flatten our curve once again to keep everyone safe. Please, everyone, stay the course, remain vigilant. Coronavirus is here. It's not going anywhere soon. Please, in public, wear your mask, socially distance, pay close attention to hygiene and hand washing. Thank you very much, and now I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. I'd like to start by thanking the citizens of Tulsa for the way our community handled the past week, and in particular Saturday. I've heard from fellow mayors from around the country who are just so impressed by the way Tulsans handled what could have been a really volatile day, and instead just reminded the country of the really basic decency that exists in our community. A big part of that, of course, is because the environment for basic decency and a peaceful exchange of views was provided by a broad coalition of first responders and law enforcement personnel, not just from here in Tulsa, but from a broad range of this area of the state, all of whom came to Tulsa to assist in making sure that this was a safe weekend for everyone. I've seen some stuff in the national press that I think is really unfortunate, that anyone would blame those who were providing security for people on Saturday with the occupancy level of the BOK Center on Saturday night is absolutely ridiculous. I spent most of the day on Saturday with our police in the command center, monitoring security cameras, monitoring the movement of security personnel. I can tell you that we had several different gates for people to get into the BOK Center, and there was one of them that was temporarily obstructed for maybe 45 minutes, and that was mid-afternoon when that occurred. By the end of the day, we actually got the notification from the BOK Center. Everyone that is outside that wants to be in, we believe, is in the building at this point. I think some folks have tried to throw security personnel under the bus, when the reality, in my opinion, is not some grand conspiracy. It is simply what you saw at the BOK Center on Saturday is what you saw in restaurants across this community when they reopened. It's what you saw in stores and other facilities when they reopened, which is that people are just generally cautious. And regardless of what governmental mandates are in place, people are going to use their own personal decision-making and comfort with risk in deciding where they go and what they do. And that, in my mind, is really what accounts for the attendance that you saw on Saturday. Not anything to do with our police department or our fire department or anybody else. More importantly, moving forward, I share Dr. Dart's concern with the elevating numbers that we continue to see here. As we talked about last week, we continue to have as our primary red flag that hospitalization level. I spent time both Monday and Tuesday on the phone with the State Commissioner of Health and with Dr. Dart and with leaders of our hospitals here in Tulsa, talking both about how Tulsa fits into the overall framework of our state's reopening plan, but also, what does our hospital capacity look like? It varies, of course, by hospital. There's not a uniform presence of COVID patients in each hospital, but all of them have assured me that they remain comfortable with their overall capacity. Two of them have seen an increase. One has remained flat, and one has seen a fairly significant increase over the last month of people in their facility. And so, I also spent a lot of time over the last couple days talking with my colleague in Oklahoma City, Mayor Holt. For any of you who didn't see his remarks yesterday in Oklahoma City, I highly encourage you to look those up. I would echo everything that he had to say yesterday about the importance of the week ahead and the real, I think, willingness of us locally to act if necessary if we continue to see things move on this trajectory. The reality is, presently, as Dr. Dart said, our hospital capacity in Tulsa remains fine. And that is the primary metric that the state is using to track risk as it relates to reopening. But also, at some point, if your positive cases continue to go up, and especially if they're going up at the rate that they've been going up in Tulsa over the last week or so, your hospitalizations are eventually going to start to catch up with that. And to Dr. Dart's point, we don't want to get to a point where we waited too long to act. I've discussed with Dr. Dart, different approaches. The challenge for us right now in Tulsa around mitigating these increases that we're seeing, as you heard him say a moment ago, is that there isn't, one big event that a bunch of people were at and went and spread it. It is a series, and I hadn't heard the Serious 7, but I think that's a really good list, and it aligns with what I'm hearing from colleagues and other, both at the state level and in Oklahoma City, around events that are real triggers for this, where people feel more relaxed and are less diligent and have a greater tendency to spread the virus. And so we're going to continue to monitor those things, but the most important thing that people can do to reduce the spread of this virus right now is to wear a mask. And I think Dr. Dart was exactly right, that unfortunately it's become this political statement. He and I were lamenting on the phone yesterday. We've been coming to this podium week after week for months telling people to wear a mask, and yet you can still go out in the community and you might see 10 to 20% of folks wearing them. But we did such a good job in the first month of holding our positive levels down. And as people get more comfortable going out and doing things, and especially the 18 to 35-year-old demographic, we're starting to see that increase because people are getting lax. I don't want people watching this to take my word for it. I'm an elected official. And if you don't know Dr. Dart, you don't have to take his word for it. If you want to know if a mask works, call your doctor and ask them. These are the people that you trust with your health and the lives of your family. So call them. Ask them if you should be wearing a mask. Those are some of the most valuable conversations I've had about the importance of mask wearing are with physicians here in our community. I've also had folks ask, why I wasn't wearing a mask on the tarmac when the president arrived on Saturday. Everyone that was standing there to greet the president had just been tested negative for COVID. That's a protocol that the Secret Service has in place. Anyone that comes in contact with the president has to have been tested and test negative before you get to be there. And so that was, I believe, the only time that I've been in public in 3 months where I didn't have a mask on, and that's the only time anyone should be in public without a mask on, in my opinion, is if you are exclusively in a group of people who all just tested negative for the virus. Otherwise, all of us should be wearing a mask when we're out in public and around others to slow the spread of this virus and protect people that we care about. I've been asked if we are going to implement a mask or a requirement for people to wear masks in public. I discussed that both with the State Commissioner of Health and with Dr. Dart yesterday. I think our general feeling is that we would sure like to remind people and encourage people of the importance of wearing them without placing the burden on law enforcement of enforcing such a mandate. And so for right now, we are not going to do that. If we get to a point where Dr. Dart tells me that we need to do that, though, to protect people in our community, then we will. But right now, we're not at that point. I believe the week ahead of us is going to be a crucial time for us to track our overall data as it relates to the spread and to the impact of that spread on hospitalizations. One last important announcement for today. It was in the early going of the pandemic, and we recognized that there was going to be a significant impact on our local economy from this event. I asked a number of the business leaders in Tulsa to serve on an economic recovery advisory committee to advise me on what we as a city should be doing, both to get through this pandemic, and also to emerge on the other side of this pandemic stronger as a community. I'm incredibly grateful for the amount of time that the members of that committee have put in, and this includes CEOs of the largest companies in town, former mayors, nonprofit leaders, healthcare officials, and today we are releasing their recommendations coming out of that. It is all online at cityoftulsa.org in this document. It is a really good mix, I think, of both short-term objectives, things that we as a community, not just the city government, but working with the Tulsa Chamber and other business entities within our community, that we can work on together to get done quickly. And some of those we're already doing, like our Resilience and Recovery Fund that we have for funding small businesses in this challenging time. But then we also have long-term goals in this, things that perhaps we can be addressing now that deal with larger structural issues in Tulsa. For example, that the scarcity of angel investors in our city. You can have all the great entrepreneurs in the world in a community, but if you don't have the investment capital there willing to invest in their great ideas, they can't get off the ground. So there are things like that, larger structural issues that have led to disparities historically within our community when it comes to economic development that are addressed in this document. And I'm just very excited. I told our team at the city this morning, I'm excited about this blueprint because it gives us, I think, as a community, a comprehensive strategy around economic revitalization moving forward that everybody in our community can play a part in. And so again, that's at cityoftulsa.org. It's available on the city website for anybody who wants to check it out and follow up with us if you want to play a part in that economic recovery for our city. Now I'd like to turn it over to my colleague from Tulsa County, Karen Keith.
Thank you, Mayor. I'm just showing my little mask because it's the new normal. And as I look out here at the media, I see bandanas, I see branded Tulsa masks, and you guys have been the best, I think, at supporting the masks. I know a lot of your companies are requiring it, but thank you for doing that because you are making a difference. So I have some of the latest news from Tulsa County that I want to share. On Monday, the Safer Tulsa County, as part of the CARES program, a joint effort with Tulsa County, the Regional Chamber, and the Tulsa Area Emergency Management Agency, they launched their program to great success. As of late yesterday, the team had received 961 applications from small businesses and nonprofits and handed out approximately 300 kits. The owner of Landers Ranch, one of the recipients, said the logistics for pickup of the kits at Expo was the safest experience since the beginning of the pandemic. And I know having Tima there was a big help in that. Other small businesses in the area with less than 50 employees have also applied and received kits, including, now these are Tulsa Symphony, the Tulsa Historical Society, the Girl Scouts, many others, and including many hotels. The program has a total of 2,200 kits, with some businesses receiving 2 to 3 of those kits, depending on their business size. The team anticipates that the program will wrap up early next week, given the current supply and demand. Before that happens, though, you can still visit www.tulsacounty.org/PPE to fill out an application. And we're so pleased that a portion of the CARES Act funding we received could be used to provide these necessities that will help our small businesses and nonprofits recover from the impacts of COVID-19 quicker. And the election board, we do have an election coming up, and they continue to prepare for next Tuesday's election. They sent out more than 30,721 absentee ballot packets. Yesterday alone, they sent out another 6,000, close to the total that they sent out during the 2016 general election. So far, 9,569 have been processed, and another 2,000 arrived and will be entered today. Now, if you did that, your ballots must be in the mail and received by 7 p.m. election day. So if you have not filled them out, now is the time. So make your choices and make your vote count. Early voting for Tuesday's election will be available Thursday, June 25th, and Friday, June 26th, from 8 a.m. to 6 p.m. So be sure and take advantage of that if you want to. Also, Saturday, the 27th, from 9 a.m. to 2 p.m. Now, the election board offices at 555 North Denver Avenue are all set up and COVID safe for you to go do your in-person election. But you got to wear your mask. And because of COVID, the Hardesty Library site had to be canceled. So it's all going to be at the election board. And if you're voting in person on Tuesday, your precinct's location may have changed due to the COVID-19 concerns. But you should have received a letter in the mail. We got ours with a little card attached that shows you the new place to vote. So it'll let you know where to go. But if you have any questions about it, you can log on to the Tulsa County Election Board website to get information and updates on where you need to vote. And I'd also like to give you an update on Expo Square. As many of you know, the property is pretty large and can accommodate social distancing relatively easy for nearly any event held there. Additionally, the staff at Expo has spent the last 3 months getting all the equipment and protocols necessary to sanitize and disinfect with CDC-approved hypochlorous acid sprayers and cleaners, as well as ensuring that hand sanitizer and washing stations are easily accessible. And face masks are also available upon entry at any event. Last weekend, we had several events at Expo Square that welcomed 7,200 plus attendees over the span of 3 days. The events were held in both Expo Square upper level, which is about 7 acres, and a lower level, which is 3 acres. And our outdoor racing as well as the indoor simulcast center. So this weekend, in addition to the race events, the PPE for small business and the health department testing continue. So as we move forward, we are monitoring numbers, and we will be consulting with Dr. Dart for larger events as they come along. Rest assured that the same cleaning procedures and precautions will be taken at Expo Square, no matter what the size of the event or what part of the arena it's held in. And lastly, I will reiterate what you've already heard and remind everyone, please be diligent. The coronavirus is not taking a break, and we may be less afraid and more comfortable with our new normal, but that does not mean we can simply forget to wear our masks, use proper hygiene, and keep adhering to social distancing practices. This could be a long slog, so let's adapt. Let's make our masks part of our everyday routine. Have some fun with them, but wear them and help keep everybody around you safe. So thank you very much.
Good afternoon. Michael Baker, Fire Chief for the City of Tulsa. Yesterday afternoon, about 4:30, we made a decision to temporarily close Fire Station 24, located at 3600 North Peoria. Fire Station 24 had a member of the department introduce or become symptomatic with COVID-19 related symptoms, and we found that they had exposed the firefighters at that station over a period beginning from the day of Saturday the 20th. So since that point, the fire station has been cleaned and disinfected wholly. Firefighters are back into the station today on a callback basis, and we have begun the testing process this morning of approximately 36 firefighters that are on a quarantine until we get test results back. So once again, we find ourselves introduced from a situation. We believe that the member that became demonstrating symptoms came from an event outside of the fire department. It's not a job-acquired exposure, but we want to make sure that our firefighters are continue to be safe, and we're not immune from this increase in cases within the city and county. So please make sure you are diligent in your processes. We are diligent in ours, but people are getting sick, and we want you to continue to be aware that this is not something that is over today. Sure.
So does that mean other stations are responding to where that other would go? Or are they like volunteers where they get the call coming from home?
No. So that station, the question was, are other air apparatus covering that area, or do we have a volunteer staff? That is not the case. Tulsa firefighters, we are fortunate enough to have enough members currently on duty and on staff to backfill that station with Tulsa Fire Department members until those test results either come back negative or we continue focus on quarantine as needed. So yeah, fully staffed. Yes, sir.
Forgive me if I'm mistaken.
Uh-huh.
You mentioned it came from an outside event.
Correct.
It was from Saturday. So was it from attending the rally? Or
No.
protesting the rally?
Yeah, the question was that it came from an outside event. I believe it was a wedding, so much like you heard today.
Any other questions for Chief Baker? Okay, great. We'll move on to Dr. Dart.
Dr. Dart, there was a report that NBC News is showing that the federal government may suspend assistance to local communities for COVID site testing. Can you elaborate on if you've heard any of that guidance or what that might look like for our community going forward?
We haven't gotten any information from, the funding comes down to the states, to the CDC, from Congress. We haven't gotten any information that's going to change. We saw the same news bit as well, and we're trying to find out more background information around that.
What could that look like, though, if, preparing for that scenario? I know it's hypothetical.
Well, the worst case, all we keep hearing is that we have to expand testing, and if the funding suddenly goes away, you can only imagine. Now people have no idea what their status is. We have no idea what the incidence or prevalence in our communities are. If that stops, and it's just a worst case scenario that we definitely do not want to go.
Do you have any information about reinfection or some of these people who are a part of the increase being reinfected?
Early on we saw, and we haven't seen this in quite some time, but early on we had a couple instances where we weren't sure if people were being reinfected or relapsed, and the studies at that point really were inconclusive as to what that was. And frankly, we haven't seen anything new about that probably about 6 weeks.
With the president kind of minimizing wearing masks, the importance of wearing masks and the importance of testing, saying we should limit our testing, is that undercutting the efforts that we've made here in Tulsa?
I think it's important to listen to our messaging, but I think it's part of our issue is that we get confusing messages and people don't know which way to go or what information is valid. And that's why we talked today about trusted sources and infodemic to make sure that you go to the right place to get information and make the right decision for you. We're not telling people, giving them recommendations that we know are not science-based and that we know won't help break the chain transmission. So please use the Tulsa Health Department, use the city, use the county as trusted information sources so that we're all doing the same things and being consistent in ways to protect ourselves and our families.
Early in your comments, you referenced that the new positive cases in Tulsa County the past 2 cycles have actually been more so than the models projected.
Mm-hmm.
What do you mean by cycles? Can you explain a little bit more about that?
We just go through a two-week rolling cycle, so that 14-day period, and which we thought was interesting because as you recall, we got a lot of pushback about why we're using models. The models aren't relevant, and we're finding that the reality is actually worse than what the models were showing us could possibly happen. So, but we go through we'll go through various cycles: 1 week, 2 week, 3 week, 4 week. These are 2 weeks.
So when you say cycle, it was this past 2 weeks, or is it one cycle?
We had two cycles, so two 2-week cycles.
Can you address, because I see it on my Facebook page a lot, well, the numbers are going up because we're testing more. Can you address how your significant increase either matches that mentality or bucks that mentality?
We started testing more a long time ago, and we continue to test more. What we're finding though is more positive cases, and if it was just due to more testing, we would have found more positive cases 3 weeks ago. we're seeing a combination of people going into the community, trying to re-energize their lives, and not following recommendations to keep themselves safe. So as all of us continue to test as much as we possibly can, the fact that we're finding more positive and having higher percent of positive rates tells us that we're getting more transmission. And it's not strictly more testing, it's more transmission in the community.
You mentioned a few questions ago, Dr. Dart, a worst case scenario. In your opinion, what's the best case scenario from where we are right now?
Best case scenario is that we go back to the guidelines that we were following when we were flattening the curve, that we wear masks out in public, that we social distance, that we pay close attention to hygiene, and we do that religiously and fervently, because if we don't, we're going to be up here talking about more and more cases and talking about concerns around our healthcare systems if we don't all become part of this response and all take responsibility to flatten that curve and to break that chain of transmission.
But in terms of duration, how long would, if everyone starts following those guidelines today, what will we see in the numbers, or what should we see?
So it's going to take, and that's why we said we're really going to watch the next 6 weeks, because, you know, chances are there were people that were exposed over the weekend. You know, incubation period is anywhere from 2 to 14 days. In that time frame, before they're actually even tested, they might be shedding virus and transmitting themselves. So it's that 2 to 14 day cycle, and that's why we're watching the next 6 weeks, so that if people really start to follow recommendations today, at the end of that 6 weeks, hopefully we can start to see, even with the incubation that's going on today, we can start to see some flattening of the curve and downward trend in cases, but we have to start right now.
One more question for Dr. Dart, then we'll start.
So given the rally this weekend and some of the consternation over whether it should happen or be postponed or whatnot, do you have any recommendations going forward for large events, either capping it for a number in attendance or only doing it if we can social distance, anything like that?
You know, I think it's a combination of these things. I mean, CDC still recommends no large indoor event over 250 people. Even if you can have an event where you can maintain social distancing inside a building and people wear masks and following hand wash guidelines, it's still going to keep people safe. So I know that we had that number from the CDC. That number has, as we go out through phases, that number has changed, of course. But it's not so much the number; it's how people conduct themselves at these gatherings that really is a concern. Now, if you have a building where you can't social distance and people refuse to wear masks, it's going to be an event where a virus will spread. So, yes, we want to keep numbers down of large indoor events as much as we possibly can. If people do come together, follow these recommendations and follow them fervently, and if we do that, we'll start to see a flattening of the curve. But if we don't, all we're going to see is more disease transmission.
Thank you, Dr. Dart. And
Thank you.
Next, we'll take some questions from a runner.
So I kind of want to follow up on that, again, the controversy over the rally. So you've mentioned a few times that the city is now following state guidelines where it comes to social distancing. But when you look at the state's, recommendations, it says that social distancing is at the discretion of business owners or local officials to determine when and if social distancing measures should be applied. Business owners and event organizers should use their best judgment, taking into account factors such as location, size of the venue, and determining appropriate level of social distancing. So I guess why didn't that happen here? It sounds like it's kind of being pushed onto the state, whereas the state has left it up to your discretion.
Yeah, no, that's a great question, and that is at the root of the ongoing discussion that I had with ASM, the operator of the BOK Center, for about a week before the event took place. As I told them on a call, it was either that Saturday or Sunday, did a lot of calls that weekend, I can't remember which day it was, but told them, they are one of the top event center operators in the world. They know what they are capable of doing in that facility in a safe way, and whatever they decide they need to do to protect the people who paid to build that building, I'll have their back on that. Now, what I did not want to do was get into the business of throwing out a regulation that's designed to impact one event. I think that has legal issues around it. But we are evaluating right now, that's another conversation that I've been having with our team at the city is around overall limitations on event sizes moving forward. But that's part of a larger discussion around just how do we as Tulsa, and I would say Oklahoma City is having the same discussion, how do the state's two largest, most densely populated urban areas fit into a statewide reopening plan that is designed to apply to every community equally when it comes to density, we're not equal. And so one of the challenges for us around an event restriction that we were discussing in my office this morning is that everything we're hearing right now, based on the data we're hearing around the causes of this uptick in cases, again, it's not from people going to protests or to rallies. It's from people going to weddings and funerals and family gatherings and bars and other things like that that are causing this uptick. And so, I'm on the one hand, I'm perfectly ready to put that regulation in place if we feel like it would be helpful, but I also don't want to put a regulation in place that isn't really addressing the cause of the uptick that we're seeing.
So do you have anything in mind that you can kind of bandy about that you're considering for a size or regulation? You said you've been talking with city leaders and officials about it.
Yes, and so, we initially, when we were ramping up, the first time we started with event size limitations. I think our first limitation, if I'm remembering correctly, was 250 based on CDC's guidelines at the time. They later lowered it. But I think that is something, as Dr. Dart just mentioned, that is still one of their recommendations for large indoor gatherings. That's something that we're considering. But the conversation I had with, and everything that conversation I had with Mayor Holt yesterday, which is everything that we've done so far, we've tried to do in concert so that the people in the state's two major metro areas are impacted in the same way at the same time. And so I would say, that is on the table, masks is on the table, but I really want to have more conversations with the State Department of Health, with Dr. Dart and his team, and with my colleagues at cities in the Tulsa metro area. I don't want us to run into what we, by necessity, ran into in the early going of this pandemic, where Tulsa did something and then it was a scramble for our suburban neighbors to understand why we'd done it and decide if they were going to do it or not. I'd really rather us talk as a group and decide if we're going to do something, because this is impacting all of Tulsa County, not just the city of Tulsa. What does that look like? And we have that discussion with other cities scheduled for Friday.
So if in 2 to 14 days or 10 days or so, we start to see a spike after the rally and protest this weekend, what kind of message will that send to everyone as to what's happened?
Well, I think our focus overall, and I said this last week, my great concern with the focus on the rally, and it's a valid thing to be talking about because we're the first city in the country to host a major event. So I get why the questions are out there. But the concern for me is that we have a metro area of 1 million people who are going about their lives every day, and more of us, getting lax in how we go about our daily lives, and that is what is causing this uptick. This uptick began long before there was any event last weekend. And I don't want us to be communicating that if you just don't go to a big event, then you're in the clear and you can do whatever you want. Our challenge, and it's a real communications challenge, and my hope is that the Tulsa Health Department will get the financial support that they're requesting for expanded communications support for a public campaign around this. But we have to communicate to people in the Tulsa metro area the importance of social distancing, washing your hands, and keeping that mask on. And what we've been doing to date, the numbers are showing it just isn't working. So we have to do something better than that.
So at what point do you get on the phone with Mayor Holt and come up with a plan that's kind of a different path from the hours plan? Because obviously you're dealing with something completely different than do right. So
Yep.
at what point do you get on the phone with him and say, it's time for us to take control again?
So the question was, at what point and I'm sorry, I was really impressed. Chief Baker needed no prompting to repeat the questions, and I forget it every time. But the question was, at what point do I get on the phone with Mayor Holt and talk through what we might do in Tulsa and Oklahoma City that's different from the hours plan? And the answer to that is he and I talk pretty much every single day and have throughout this, and will, I'm confident, over the next week. He's working with his local health department. I'm working with ours. And then we both, yesterday, were on the phone with the State Commissioner of Health talking through how Tulsa and Oklahoma City relate to this larger plan. So I absolutely expect us to continue those discussions over the next week. And I think he and I both have in our minds that this next week is a critical week for identifying what, if anything, Oklahoma's major urban areas are going to have to do to get these numbers under control before they start to endanger our hospital capacity.
Last question?
With Mayor Bynum,
Yes.
You've been very clear last weekend today that you're disappointed in how many folks are wearing masks around town and in the metro. I'm wondering, is there a policy and are you concerned about the rate of mask wearing for city or municipal employees? And I hate to single out TPD, but they're the most forward-facing, identifiable group, and not all officers wear masks. Is that something you're concerned of or following?
So the question was, do I have a concern about our personnel at the city of Tulsa who are out in the field if they're not wearing masks? That's a great question, and I'm glad you asked it. That is something actually that I need to talk with our staff at the city about as far as an overall policy, because it is, you heard today just one example of the impact it can have on our organization and the ability of the city to serve in a moment where you had one firefighter who went to a family event and came to the station and ended up spreading it, and having to overnight shut down a fire station till we could reopen it this morning after it had been cleaned. So our ability to serve and protect the citizens of Tulsa is reliant on keeping our first responders healthy, the folks that are out working on our water lines and sewer lines and in our parks healthy. So I think that would absolutely be a good policy for us to put in place at the city. I know that at City Hall, no one is allowed to walk even down a hallway without a mask on. So that should certainly apply to folks that are out in the field as well.
Rick, one more question?
With the 4th of July around the corner, a lot of people staying home, are you thinking about relaxing the fireworks ordinances at all, allowing for fountains and things like that? I mean, obviously not the ones that go up high, but will you allow people to light fireworks at home as an effort to keep them inside?
So the question was, since we're encouraging folks to stay home, and there aren't, like the major fireworks display that we would usually have on the 4th of July has been moved to the end of the summer this year, will we, relax the overall rule on fireworks displays? One, I don't believe we have the time to do that because it's a city ordinance and the council would have to take action. Two, we have a brand new fire chief, and I can think of few things that would give him more terror brand new in his job than to relax the fireworks ordinance in the city. He's had enough in his first week on the job without dealing with that. So no, that is not something that we're focused on. But I do want to conclude, because that reminds me, I heard the remarks yesterday of the governor of Texas, and let's just say I think that he is a very conservative man. And Texas has been a leader in the country in reopening. And what Governor Abbott had to say yesterday was that for everybody in Texas, you should still follow the rule that if you can be home, then you should be home. That still is the safest place for you to be. And I think I was really impressed to hear him say that. And I think that's a good message for everybody. As a reminder, my family is certainly continuing to follow that, and I encourage others to do so as well. Thank you very much.
And we'll have some questions from our commissioners.
Okay.
With all of these absentee ballots that have gone out, the election board has obviously overspent their budget in ways we haven't seen. How are you all making up for those funds, with the high demand of absentee remaining on?
Well, we always know that we're going to have additional dollars for the election board during elections. But Rick, you're absolutely correct. They're having to spend more dollars. I know they're working. I think they got finished at 1:30 last night, and now they've got to get through. What they say, 5,000 more today. So they are doing everything, and they've just not stopped. They've just been working consistently. But we will figure that out and make sure that they're taken care of, because this is the single most important thing. And something a lot of people didn't know is that the state called and required us to move everything out of the election board prior to the rally, and so that they sent in these rider trucks and took them all to Expo Square and put them inside a building, because this election, of course, every election is so important that people have the ability to vote. So they did that as a precaution, which was kind of interesting.
Have you heard anything about, because the poll workers are so old, we heard there was a risk of consolidation of polling places. Have you heard of any consolidation or closing of polling places yet?
Oh, yes. I mean, we got a letter saying that our polling place had changed with a new card. So people are getting those in the mail, so you need to watch for it. But if you have any questions, look at the election board county website to see if anything's changed. And we had to close down the Hardesty Library, which was early voting. So all of that early voting is at the election board at 555 North Denver.
Commissioner, I'm not trying to connect the dots here, but if the Trump administration, the president visited this town, and then days later, his administration is saying they might cut federal funding to testing, and this community was potentially exposed to a super spreader event, which we have yet to know. I hate to connect the dots here, but the dots are pretty evident. How does that make you feel that his same administration could be cutting resources to a community that he visited?
Well, I have to hope that the other leadership within that administration will say, that's not a good idea. We need to stand up more testing. And I think that Dr. Fauci will be loud and clear on that message. I mean, he had such a good statement talking about masks, and it's just one of the best sound bites I've heard on that. It was really inspiring. It was just something I think we all need to pay attention to, and we've just got to make it our new norm. And I've seen people at the county, we've got all these women, they're making these masks, but they have a mask to match every outfit, which I don't have. But I just think, we need to brand them and make them better. And also, Chief, do you want to talk briefly about why the police officers don't always wear masks? Because he gave me the best explanation. I wondered that as well. Yeah, I mean, he just gave me the best explanation in the world. And then before you all depart, I do want to get a picture of all of you with your masks on, because I'm going to put it up on Facebook. Because you've been the best. I'm not kidding.
Okay, an impromptu visit by
Sorry.
myself. That's okay. I was just telling Commissioner Keith that the reason why you don't always see our officers wearing masks is because they need to have that facial expressions. They need people to understand exactly when they tell a person to do something that they are doing that. I don't want that obscured by a mask. I don't want anything misconstrued from officers when they are out on the scene giving orders. They are mandated to wear them inside of the building when they meet for squad meetings because, again, large gatherings, I don't want someone to have come from a wedding and then introduce that into the squad room, and then my entire shift is no longer useful out in the field. So they wear them for that. They wear them when transporting, and they obviously have access to them on their person to wear at any time that they see the need to don that facial protection. So again, we operate on radios. Radio communication is very important to us. The dispatchers need to know where we are and understand clearly, as we need to understand our dispatchers clearly. Our dispatchers are not wearing PPE while sitting at the console working a station. So that's the reason why you don't see them more outwardly, but they are wearing them inside of buildings, inside of the uniform divisions as they conduct squad meetings. Okay?
While we have you, do we have a dollar amount? I asked last week, we know what this looks like as a cost to the city and your department?
We don't have a dollar amount yet. That's going to be at least a couple of weeks. The Tulsa Police Department still operates on paper and carbon paper to process overtime. So that's going to be a little while. Everything is via paper. It's not electronic. That's something that I would love to see changed, and hopefully we're working towards that.
Can I take a picture? Would our team